Thank you for joining the third segment of the IHS ITU Health Facility Cancer Care Assessment Collector. This tool, as you've seen in the first video, a tour of how to use this application, and the second video, referring to reporting information for ITU health facilities, allows you to understand how to appropriately report information about cancer care services. This third video is specifically focused on the referral sites, locations and health practices that are not IHS affiliated, but that are a part of the network of support for cancer services, often with a referral relationship from an IHS facility. What I want you to notice as well on the map-based application is that while IHS facilities are listed on the map, if you notice as you zoom into nearby locations, non-IHS facilities are also included on the map. These referral sites can either be selected directly on the map or could be searched within this location here. If I were to search by facility name, Idaho Falls, I could see that there is a center here where when selected, I can, just like on the IHS tool, select a menu to view information about the services reported at this facility. Just like in the primary IHS facility location, if I want to update the information reported at this facility, I can select this button here, Update Cancer Services Information, which will provide me a new link to a new tab where I can fill out a survey. If my name is not already listed here, I can select Other and provide my name and contact information here. This is particularly important for data and quality assurance down the road when we're trying to validate information about services at this facility. As I'm going through here, my ability to edit information here includes changing the facility name of this referral facility. This will be very important as these facilities are not affiliated with IHS, and so our ability to find accurate information about the name of this location, its contact information, or address will be important here. You may notice as well that in the map question, or in the survey form, there is a map question here. How we recommend folks modify it is that if we need to change the address for this particular location, do so by filling out the survey question here, reporting this change of address. And if necessary, if you have changed the address to a different location, you can press the recalculate button where it will place the point correctly on the map for others to find it, both in the collecting tool and in the patient navigator. If there's anything unusual about this location, such as it has a separate entrance from the primary facility, or is located in an area where information might be helpful, such as an office number or hospital floor, please feel free to provide that here. In addition, once you've completed this questionnaire, the remainder of the questions will look exactly as they do for the IHS facility, where you can report the cancer screening services provided, diagnostic services provided, or treatment services provided. For example, in this question here, it was listed that treatment services are provided. However, I may use the remaining questions to provide further details, such as whether infusion, radiation, surgery, hospice, and palliative care are provided, as well as specialty services and support services for patients and their families. When I've completed this survey and I press submit, this will add new information directly to the record so that it will update not only in the cancer assessment tool, but also in the patient navigator application. If I search for a facility and I cannot find it, be certain to look through other keywords as well too. So for the Idaho Cancer Center at EIRMC, if I weren't seeing it on the list, I could also search by EIRMC to be certain that I have found the correct facility for information. If I have not found this facility and I wanted to report a new location that is a referral site, pressing this button here, Add New Referral Site, provides me the opportunity to provide new information such as the name of the facility, its address, and ultimately what services are provided on site. This new location will then be placed on the map both in the collector tool and in the patient navigator application. If you are adding a new facility, please be certain that a facility has not already been added in the database here. This way we can try and reduce redundancy in the information we collect, and we can feel confident with the information we are providing to our community. This is the final of the 3 video installments. Please reach out with any questions if you need any support using our Cancer Care Assessment Collector or any questions about how to answer questions within a particular survey. Thank you so much for your time and attention to detail in helping collect information about cancer services at IHS facilities.